Hello everyone, and welcome to today's AssureCare CompleteCare webinar series, a pharmacy perspective on healthcare services. Today we'll be discussing current medication management issues and ways to improve patient outcomes. My guests today are Jim Gardner, the Executive Vice President of Clinical Strategy, and Steve Joes, the Vice President of Product Management at AssureCare. Jim is a pharmacist with over 20 years experience both in retail and pharmacy benefit management, and Steve has over 10 years experience within technology from both a marketing and product management perspective. Thanks guys for being here.
Thank you.
Thanks, Pat. Thanks, Patrick. So good afternoon. I'm Jim Gardner, EVP of Clinical Strategy at AssureCare. And as Patrick said, I am joined by Steve Joes, VP of Product. Today, we're excited to present how our platform enables pharmacists to practice at the top of their license, and how health plans can utilize our platform, MedCompass, to have a member 360 view right within one platform. A compelling feature that our platform at MedCompass was built to assist health plans and pharmacies alike in integrating pharmacy management into their daily activities. The integration doesn't just stop at health plans and retail pharmacies. It can include specialty pharmacies and even retail clinics within pharmacies. The platform can also prioritize and task functions of medication management and a complete medication therapy management program. MedCompass is really an all-in-one platform to identify opportunities to improve care and enable pharmacies to perform clinical services and build them on the medical side. As a former health plan pharmacy leader, the value of bringing all this data together is immense. This brings pharmacy into the mix as an important part of the puzzle for managing health plan members and retail pharmacy patients. Pharmacy is no longer the little department in the corner of the office. So really taking forefront in bringing pharmacy and integrated into the whole healthcare paradigm. Steve, you guys, AssureCare has come up with a great model with integrating this pharmacy piece into the model. So where did this vision start to integrate pharmacy into the MedCompass platform?
Thanks, Jim. So where we started was the care management space. So a lot of case management, utilization management, and so forth. And one of the things that we looked at pretty clearly was that if you were going to truly manage a patient or a member in a holistic manner, which we did, right? And we built our product early on with the notion of being member-centric. We looked at that from the perspective of how can you really understand everything that's related to a member's care and health if you don't track their medications. And when you're looking at statistics around the number of preventable deaths and poor outcomes relative to medications that conflict from different specialists and so forth, it's an obvious place for us to go and an obvious place for us to build out our offering. And so we began with that comprehensive medication review that dovetailed in very nicely with a lot of the complex case management work we were doing. And as we got into that, we started to do different things with our assessments, digitally delivering them via tablet and so forth, the ability to integrate data from the member record and from other sources like dispensing systems to pre-populate chunks of it to make it more efficient. Obviously, in any situation in healthcare, we have a very fragmented space. And so getting all the data together it becomes a challenge. And so having something that's highly interoperable was very important. One of the other things, though, that we noted, and it was just sort of an issue across the board, is part of that fragment. When you think about fragmented technologies in healthcare, a lot of the times at least I think of the fragments that you run into with the members' data, where a little of the data is over here and a little data is over here. Maybe there's maybe an HIE starts to bring it together, and that's definitely a significant issue. The other issue, though, is the workflow component. The notion that, if you're going to materially impact a member's life, being able to reach out to them through in a way that they want to be reached out to. So having the ability to text or email or conduct a telehealth appointment, those types of things are incredibly important as well. And it's another area of focus for us as we look. And of course, as we move through all of that, you want to have good analytics and dashboards around why is it that where should you be spending your time? Who are the people who are the most at risk? who are the people potentially are the most costly as a result. Making sure that we have those kind of analytics and views, as well as being fully compliant with CMS. Because obviously, if we're going to start, especially starting with a comprehensive medication review, you're starting with CMS standards, and so making sure that we look at those things. And in fact, we were fortunate enough to be able to participate in the development of the e-care plan standard as well, and so that was a great opportunity to make sure that everything we did was in keeping with where the space was going and be out front of that. And so that gives it a little bit of our background. And Jim, back over to you to talk a little bit about those solutions.
Thanks, Steve. So as we move forward in our discussion today, I just want to bring out some of the solutions we developed for retail pharmacies, and then I'm going to follow that with solutions for health plans. And so more and more pharmacists are being recognized with provider status. More pharmacists have prescriptive authority. States, daily are approving prescriptive authority within their state and are engaged with prescribers with collaborative practice agreements. So it's exciting to see the pharmacy profession moving forward from where it was. This has enabled the pharmacists to move away from just a product focus to a clinical service focus. Many of these services need to be built on the medical side, such as doing an HbA1c lab draw or diabetic coaching or monitoring. These now could be billed via the MedCompass platform, and it'll capture all the necessary data to bill. If desired, we can even provide collection services for an additional fee. A few other important items to mention, and these are use cases that a pharmacist can do within the clinical services realm. Some new things that they could start thinking about to provide services, to continue moving that pharmacist along this continuum. So MedCompass enables medication management capabilities, and our platform is certified to produce an e-care plan, as Steve just mentioned. This could be sent over via FHIR, which is a way to transmit data over to physician offices, and it can go into their EMR. It's a true pharmacist care plan. And this integration is critical to demonstrate the value to the physician, and most importantly, it advances patient care, as care is not provided in silos, but shared. Through configuration, we can take your pharmacies or health plan data and identify patients that may be candidates for services such as daily dose packaging, pharmacogenetic testing, and who are those members that are eligible for Medicare. So let's go back to daily dose packaging. So our platform can identify patients that are taking 8 to 10 medications. It'll identify and then task them to a clinician who then can work with that member to get their medications in daily dose packaging to make them sure that they're more adherent with their medications and that they're on track with taking them on a daily basis. We're set up with a vendor and they will help assist with that process. So pharmacogenetic testing, that's a hot item right today in the marketplace. And so if there's a member that are on certain medications, and we can identify those medications that we want to work with a retail pharmacy or health plan to identify what are those medications that people are taking that would benefit from pharmacogenetic testing. So there's a number of medications out there. You probably don't want to look at all of them, but let's say 10 medications you want to look at for candidates for pharmacogenetic testing. And so we can, again, take the pharmacy data, identify those members for that type of service, and then trigger a task to the pharmacist or technician to have a conversation with a member about how to get pharmacogenetic testing, and then follow through for that patient to set them up for the test. This helps to make sure that these medications that members are taking are working properly, because in many cases, medications don't work properly because of a patient's gene makeup. So again, another benefit that a pharmacist can get involved with that we haven't seen them being involved with in the past. Another thing is important at the pharmacy is to, and even within health plan, is to identify people that are Medicare eligible or aging into Medicare. And so through our platform, we again are able to identify those patients. So we can look for those patients that are turning 65 in 2 or 3 months. We can connect that patient to a Medicare plan by providing data, so the pharmacy data and what pharmacies they like to go to. And we'll set them up so they can then go out to a link, working with a company called eHealth, and they can identify what's the best plan for them based on their medications, their primary care physician, and if they have a pharmacy that they really like going to, they can continue to go to that pharmacy. Through this method, they'd be able to identify the best health plan for them, for their Medicare Advantage. So these are just a few cases that demonstrate new thinking for pharmacists and services they can offer. Also, although some of this has been going on already, the use of a platform such as MedCompass makes the use cases come to life much easier. Our communication platform enables telehealth communications with your patients, as it's simple for the patient to join. A text is sent their way, they click on the link when the time comes, and they're really easily sent into a telehealth conversation with a clinician. That could be a pharmacist, technician, or case manager. So again, telehealth is built into our platform so you can be enabled with those types of services. A final use case I want to touch on is vaccinations. Vaccinations are a critical service that has been provided by pharmacists at an increasing rate year after year. And why not, given the pharmacist is the easiest healthcare professional to access. With the upcoming release of the COVID-19 vaccine, which are hearing great things about over the last week, the pharmacist becomes more visible and active in vaccinating. So it's exciting to see that the pharmacist is considered to be a central point for these vaccinations. Along with the administration of these vaccinations, it is critical that this event is captured in the state vaccination registries. MedCompass is built to have bi-directional data exchange with the vaccination registries. We will just need a health plan or retail pharmacy's assistance, as we can only do that exchange based upon your contracts with the state. Patrick, you can go to the next slide. Now let's take a look at how MedCompass works within a health plan. The clinical services that a retail pharmacy can now provide welcomes the pharmacist in as a provider to build a health plan for the services on the medical side. They just need to allow it. Of course, it gets a little more complicated on the Medicare side, but billing codes can be adopted. For a regular, if it's not a Medicare health plan, they can allow these services to be administered by a pharmacist. They would just need to set it up in their system to allow for coverage for those certain services. With a shortage of PCPs nationally, health plans should be willing to pay for these pharmacist services. The MedCompass platform can also combine utilization management services, both medical and on the pharmacy side, care management, and the pharmacy modules. We are even bringing quality metrics into the platform next year. This provides a member 360 view, which is great to assure all pieces are captured for the patient. Next slide, please. Now let me take a deeper dive into how medication coordination can be achieved within the MedCompass platform for health plans. The medication management module is part of the platform solution. You're able to perform assessments, which are part of the platform. These assessments can be used for complete medication reviews, targeted medication reviews, and medication adherence reviews as examples. These assessments could be triggered by the health plan providing the data on who needs to have these assessments done. These assessments are based upon criteria set by Pharmacy Quality Alliance, which is the quality measurement association regarded as an expert in this area. There's also the ability to do a medication reconciliation, which in many respects is required by CMS, as long as pharmacy data is loaded into the platform. When the data is loaded, First Data Bank or Metaspan are integrated in the platform based upon your contract, and we can identify drug-drug interactions based upon the medications a patient is taking. Medication reconciliation is a critical need as patients transition from one place of care to another. A review of their medications is important. And I'd stress it's most important that the pharmacist is involved in that medication reconciliation. So having access to one system across the health plan would be critical, and a pharmacy department within that health plan could get involved very easily into that medication reconciliation process. As for the medication therapy management program, which isn't available as an additional fee, we provide a network that is aligned with your retail pharmacy network. The pharmacies are reimbursed for services by your AssureCare, and an invoice goes to the health plan for those services. Also, we'll do patient identification for you. So all those assessments that we've loaded into the system, we have algorithms aligned to those assessments, and we can do the patient assessment identification or patient identification for you. We can take pharmacy, medical, lab data, and identify those patients that need their assessments completed. Given this is a Medicare required program, support will be provided for all the necessary CMS reporting. With that, I'll turn it over to Steve to dive deeper into our offering.
Thanks, Jim. So to begin, we want to start off with the configurability of our product relative to the implementation component. So one of the things that you find pretty quickly is that everybody's workflows, even though everybody's doing similar things, there are different workflows that are unique to different individuals. And so the very first thing that we always start with is trying to understand, as best we possibly can, all of the things that are all of the workflows that are currently in place. But in contrast with that, or at least in concert with that, we also, from the MTM space, know that there's a lot of grappling right now with how do I want to, or what is even if I know how to do medication therapy management type interactions, how might I do them more efficiently? When I'm, as Jim mentioned earlier, moving away or migrating from just looking at the product, prescription fills and that sort of thing. That's a busy job, right? It's a lot of work to get people out the door. If you're in the health plan side, you're processing your authorizations, you're doing your complex case management. Again, you already have a lot to do. And so if you're going to layer this piece of it in, how do you do that as efficiently as possible? And so one of the things that we do with our implementations is we deliver a pretty set workflow that can be used as a guide. But also we would hope, as a good revisit of some of the things that you might be doing today, and in order to really have a good conversation around what's important and what are the types of things that get in the way of what's important. So it can be a little bit of a change management activity in addition to being a great discussion around how do we work on this tooling. And so one of the things that we do, though, in addition to that, is we have these items off the shelf, but then we also look at where do we configure it, where do we change it, what are the types of roles that we're dealing with, is it if we have a tech pharmacist relationship, what do we want the tech to be able to do? That varies. Not everybody does it the same way. Versus what do we want the pharmacist to do? So having security roles that are set up, queues and tasks and things of that nature that are set up, making sure that all of that workflow is configured in a way that makes sense, offering a strong baseline, but making sure that it can be edited. And that includes editing potentially assessments as well. So we have a series of assessments available based on, common medication therapy management, but activities, evidence-based approach that we follow. But if there are, we're a partner in that regard. And so if there are other features or assessments that have been very, very helpful, those types of things could be either added or things that we already have could be changed or altered or augmented. The other piece, of course, is, and Jim mentioned this earlier, was the integration of data. We have this, one of the other things that's just so critically important is the ability to integrate and get the data that's necessary to manage care into a place where it can be seen. If you're going to have a patient-centric or a member-centric system, having all of the data that's relevant to their care is really, really important. And so having a set of off-the-shelf integration framework stuff that people can use and integrate with, get all that data into the same place so it can drive clinical activity and be there for reference is really important. Go to the next slide. So as I mentioned earlier too, the idea behind not only just getting that data into the same system so that you have the appropriate history, but also being able to then act upon that data, right? You want to have actionable data. And so having a series of tools like Metaspan and First Data Bank, having those those premium databases available to run drug interactions and drug allergy interactions, and potentially drug food interactions. That's an area that is not done as much with, because that information is not there as frequently. But food is such a huge component to that being able to run those types of interactions and do that analysis is critical as well. And so also then ability to automate activities through business rules. I want to send a person an email on a such and such a day, or I want to send them a text because that's their preference, and I don't want my users to have to think about that. So from an off-the-shelf perspective, how do we get that data, and how do we get those interventions out to people in an automated way through a combination of business rules and then integrated tools around that deliver texts or emails, or as we mentioned earlier, virtual health, and we're going to talk about that a little bit more in a moment. And then also other educational resources. So having access from an interoperability standpoint through to HealthWise, and First Data Bank also offers a series of educational materials through Education. So having those items available as well to really get the kind of the industry best practices and deliver those to people without having to go to a bunch of disparate sites, that interoperability really makes the care delivery a lot more efficient. Let's go to the next slide. And of course, we have to wrap all of this up with the CMS compliance and quality reporting. So we mentioned the e-care plan standard that we participated in the development of through CMMI grant. We also have a series of existing ETL, extract, transform, and load processes to render data extracts that can then be sent to various parties. We offer a series of dashboards, and I think going back to that notion of actionable data, having the ability to cross-reference these different PQA measures, STAR measures, things of that nature, and being able to see which population of patients will most be impactful to those, or who are either most at risk, or if you're close, if you're right at the line of being able to move from a 3.5 to a 5-star or to a 4-star rating. Is there a particular campaign that you might want to reach out and push? Being dynamic in those actions and being able to update based on the most current information about your patient pool. Who can you reach out to have the most, to improve the outcome the most, but also potentially improve the scores the most. And of course, you have these CMS quality metrics around PDC, adherence percentage, et cetera, and having all of that available. Those are standards, and so being able to deliver that as part of a base configuration of a product is beneficial in that regard. So you're not necessarily having to go back and evaluate what's needed. It's already there. We've also, from that, as a result, because of that, have been able to build some algorithms for patient identification relative to the Pharmacy Quality Alliance, the PQA measures. So being able to have algorithms that can look at a fill history and crawl through those, looking for gaps or too frequent, too little, adherence calculations, other gaps in care, et cetera. But being able to really get that end to end. So you have that patient identification from an algorithm perspective at the top, all the way through to developing a plan of care through the assessments, and then finally delivering it in the appropriate outreach through text, email, telehealth, et cetera, and then finally closing it out with all of the back-end reporting. We'll go to the next slide. And I did just want to take a moment to deep dive, based on our current pandemic situation, on the telehealth component and their remote readiness. One of the things that we've seen in case management that's been hugely impactful is the notion of being able to really interact with the person in as person to person as possible. Now, for pharmacists, that's not too unusual, right? I mean, the person has to come into the pharmacy frequently to get their medication, unless you're trying to switch them to a 90-day fill or something of that nature. But the pharmacist tends to be the providers that the person sees the most, and so to some degree that piece is really pretty critical. However, you could still build on that, and there's still the opportunity to create an efficient, effective way of mirroring and working with a member without them necessarily having to physically come in, which obviously during the COVID-19 pandemic has become pretty critical. So fortunately, we had already started to use that capability in some of our case management activities where, we saw, we had a series of case managers who were going into the home and they had the application on their tablets, and they would have conversations in the home with the member, and they liked the tablet experience very much because it allowed them to kind of maintain eye contact and those kinds of things that they didn't necessarily get to do when they were doing a lot of telephonic case management. And so when COVID-19 kicked in, they migrated that process because they didn't want to lose it over to the telehealth tool that we offer, because at that point you could still maintain that eye-to-eye contact without really losing something. So much of the case management, care management type activity is very similar to the type of patient counseling we get in a retail pharmacy. So we definitely have seen it at the health plan, and we've seen it in the pharmacy as well. And I believe I have one last piece I wanted to bring out. So from a deployment perspective, one of the things that we look at obviously is we've built our product at this point to be cloud native. So it's accessible anytime, anywhere. We wouldn't be able to deliver the tablet experience that we deliver if we weren't. And so the ability to get that into that whole application that historically has always been locally installed and kind of clunky, into the cloud, where you can get all of that information and all of that capability delivered right to your tablet or even your smartphone. That works. That's hugely beneficial to really get in there. But of course, it works on a PC as well, browser-based web applications, and being able to support both that PC usage where you've got multiple monitors even, or down to that mobile tiny screen, being able to support all those levels in between. Being able to offer offline access, the ability to, if you are going to go into the home, being able to disconnect from a Wi-Fi connection or an internet connection of any kind, since you won't necessarily know what you're going to get when you get there. Being able to access it offline as well it becomes pretty critical in that regard. And Jim, I believe I'm handing it back to you, sir.
Yes, sir. So thank you, Steve. So again, I know we've mentioned this a couple times, the e-care plan, but again, this is important because I think it's a game changer in the industry. It's finally that pharmacist bringing that patient care plan, that pharmacy care plan that can now integrate into the EMR system of physicians. You're now breaking the silos, you're bringing all this information together. And Steve also mentioned it was done by a CMMI grant, and one of the groups behind this was called Community Pharmacy Enhanced Services Network. And CPESN is still driving this and still driving changes to what that e-care plan is looking like and what it engages and what it brings into the mix. So what are those pieces and parts that can be now shared with the physician's EMR system? And so it's kind of neat because they keep bringing out new requirements and we keep advancing our e-care plan capabilities. And again, this is just a great model of how, the pharmacist is now more integrated with the physician office. Next slide. This is we just want to present a list of our assessments. So we've built out a number of assessments over the year. We think we have about 45 or so. And with those assessments, I've mentioned before that we have algorithms that help to identify the patients that would need these assessments. These assessments, although not 100%, most are aligned with Pharmacy Quality Alliance, as I mentioned before. We also have some that are identifying, hey, these gaps in care. And as we continue to build out our quality module, we'll be bringing in more measures to our platform regarding quality. And so what the importance of that is that a pharmacist can be very involved in identifying gaps or helping with gaps in care and helping health plans fill the void where patients aren't getting the services they need. It could be as simple as if a patient needs a child care exam, that pharmacists could talk to the family, the patient's parents, about what they can do and how they can engage with their PCP to get their child or their pediatrician, get their child the needed care that they have. one of the things I also did while I was in the health plan space was we gave away free pregnancy kits. And through assessments, we could then have that pharmacist or technician talk to the patient as they are getting a pregnancy test that they could get free if they engage with their pharmacist. What they needed to know about meeting the needs if they do become pregnant, once they take that test and they find out that they're pregnant. They need to be educated by the pharmacist, and this is a great opportunity for that pharmacist to do this. Educate them about prenatal vitamins, educate them about the need to get into a physician within the first 90 days, so the first trimester. So there's a number of things that a pharmacist can address with a patient that, when we started developing that program, I was like, there's no way we can help. And this was driven out of, Ohio being one of the highest infant mortality problems nationally. And so it was very challenging to come up with a solution, but it was also exciting to be able to do so. So with this slide, we're going to close, but hopefully we presented some thoughts today that will advance the profession of pharmacy and how the MedCompass platform can assist. Really, the sky's the limit. However, a pharmacist don't begin to driving the charge around clinical services, the window will pass. So hopefully some of these thoughts can enable you as pharmacists in the pharmacy profession, whether it be retail pharmacy or health plans, could start thinking about new things you can do and how the MedCompass system can enable those services. So with that, I'm going to turn it back over to Patrick. This completes our formal presentation. And Patrick, if you want to open up the floor for questions.
Yeah, thanks, guys. If you have the interest in asking a question, just use the chat function to kind of have a small Q&A session. Right now, we've got one question coming in. Hey, guys, how do you overcome challenges with interoperability?
Yeah, so I can take that one. So one of the big things that we've seen with interoperability, of course, is that there's a lot of data out there. And so the very first thing is really doing that audit of what data is necessary to drive the clinical operations that we're trying to drive, and really understanding from a workflow perspective what's necessary to be brought into the system. And that part really is a good place to start, because it gets very data in many ways, especially if you leave some of it behind in its source of truth, can be a bit of a safety net, right? I feel like I have all this information, I need to see all this information. Well, sometimes going over to another system is an okay thing. But if it's something that's really, really critical to having a conversation or to driving workflow, we really want to start with that business need and that clinical need of, why do I need this? Why is that important? Do I need to see the fill history, or can I trust that the algorithm has identified the non-adherent person for me? And the answer could be yes, right? I might need to see the full fill history, and that's okay. And maybe there's a view for that, but maybe not all of that data needs to be loaded up in a way that drives activity. And so really making sure we understand what the goal of everything that comes in, every feature. I was a little focused on data there, but whether it's data or external functionality, whatever it happens to be, making sure that it's relevant, making sure that it's not overkill, and making sure that it's pulled into the workflow in a logical and efficient manner is really, really important by staying focused there. And then from there, it really comes down to, how do we get to the most clean set of standards, and making sure that we've got that we're transitioning data back and forth using accepted tools and accepted code sets and things of that nature. And where things are a little different, just making sure we identify those and making sure that we've accounted for them appropriately. And that's something we've had to do for a long, long time. We have a pretty set process at this point of how do we look through all of the different data sources and all the different functionality types that we might need, and how do we make sure that we can integrate those and bring those together in the most efficient way possible. So really making sure that we stay focused on that workflow, and then we look for those deltas early. Usually ends up being the best way to kind of deal with that, which can be a challenge, right? If you don't want to have two people start to build two sides of a bridge and end up mismatched, and so really isolating that in the workflow early is critical.
Great. Let's look at another question. Can you guys speak to more of the billing services you provide, and how do you utilize ICD-10?
So that's been one of the challenges in the industry is how can a pharmacist bill for their services? So some patterns have shown where a pharmacist will bill under a physician's ID number. But I think as we advance and more physicians or pharmacists are allowed to bill on the medical side, you'll be able to see that, yes, we will adapt the ICD-10s, and they are actually in our billing system. So where appropriate, and so a lot of that is directed by the health plan. So the health plan could allow and give permission for a pharmacy to bill for certain ICD-10s based on the services they provide. So yes, our system does capture ICD-10s, and yes, we can bill a health plan for ICD-10 codes. And again, it goes with the health plan approving that and allowing that, and then the pharmacy billing for it. So, and there's also movement towards SNOMED codes. There's movement towards more formally allowing this. But again, that relationship between the pharmacy and health plan does open the door for these types of services to be billed under ICD-10s.
Great. Looks like we have one more question. So where do you see the pharmacy market going moving forward, especially with today's current challenges?
So I think, over the years, pharmacy has really, really focused on, we're not getting paid enough. And so it is exciting, and when I say they're not getting paid enough, it's paid enough for the product. And so what's really exciting is, and I mentioned before, with prescriptive authority, collaborative practice agreements, and states recognizing pharmacists as providers, you're seeing more and more of pharmacists step up and starting to provide those clinical services. COVID's been a great example where, the chain pharmacies, some independent pharmacies, they're out in front doing COVID testing, making sure they're ready for the COVID vaccination when it comes out. And so they've actually been recognized as a provider in this space, which is really exciting. And I think that's going to, leapfrog the profession into being recognized as a true clinician and a true provider that's able to provide these clinical services. So I really see the profession, moving in the right direction. You've got folks out there such as APHA really, really driving the engine to make sure pharmacists gets recognized as professionals and, providers. So I think, got to keep the momentum going. Pharmacists need to engage, but I think all things show that we're heading in the right direction.
Great. Thanks, guys, Jim and Steve, for your participation, and thanks everyone for attending. If you have more questions, please reach out to them directly at jgartner@AssureCare or sjoes@AssureCare. Or for more information, please log on to AssureCare.com. Thank you so much. Take care.